Prenatal care for pregnant ladies is a very important thing, and since the times of the advent of the newly, prenatal care for the ladies, the amount of problems with the pregnant ladies and the morbidities in the pregnant ladies has went down very, very, very much. So now we know that the patient usually know that they're pregnant by approximately 4 weeks of gestation, which is like 4 weeks from the date of their last menstrual period. They miss their period, they do a pregnancy test, and now they're pregnant. They know they're pregnant, and they need to go visit the doctor. Many times people are very anxious about going and visiting the doctor, but really at 4 weeks of gestation, the doctor will not be able to say anything. So I think maybe waiting a couple of weeks, and sometimes even 4 weeks before visiting the doctor, might help, knowing if the pregnancy is working or not working at that time. But there is no harm in visiting the doctor, or if you're anxious, or if you're worried, or if you want to know if there is anything wrong. We're going to talk a little bit about the first prenatal visit, because the first prenatal visit is like one of the most important ones. So the patient comes to the doctor. The doctor is going to basically take some medical history from her, knows about her surgical problems, medical problems, if she's been pregnant before, if she had any blood test already done, if she's taking any medication. He's going to do a general physical exam. He's going to examine her, make sure all the medical systems are functioning normally. And after examining her, usually most of the time, she gets an ultrasound to check on the baby. What do we check for the first time? Mainly we do the ultrasound to check on viability, to see if the pregnancy is alive, there is a heartbeat, to check on the position of the baby, to see if the baby is inside of the uterus or it's outside the uterus, and to check on if there is one baby or there is more than one, because we know sometimes we might have twins. So this is another thing we check for. And the last thing we check sometimes on the placenta, usually a little later in pregnancy, not as early. Before she takes off, we usually give her a prescription for the labs that we need to do during pregnancy. And the main labs that we need to do for a pregnant lady when she comes to us as a first prenatal visit: a blood count to check if she is anemic and if her platelets are normal, her blood type to see what it is, to see if she needs any extra care during the pregnancy, an antibody screen that goes along the same line. We need to do a toxoplasma and rubella antibodies, and this is to know if she's immune or not to those two, virus and parasite, to tell her what she can eat and who she can approach during the pregnancy. Most of the time we check for hepatitis B, HIV, and syphilis. Some of us don't do that in an area where this disease is not very frequent. We usually check for a urine analysis and a urine culture to make sure if she has something called asymptomatic bacteriuria, because if this is present, you need to treat during the pregnancy so she does not have any infection going up the kidneys and causing pyelonephritis. Those are the main blood tests that we do early on. Some of us do check for something called vitamin D, because most of our population is deficient in vitamin D, and there is some data that shows that vitamin D deficiency can cause problems during pregnancy, and this is why we check for it and replenish vitamin D during the pregnancy. So this is basically our first visit. After that, and until 28 weeks of pregnancy, and for you to know, pregnancy usually is around 42 weeks. So 40 weeks from the last menstrual period, and 2 weeks we call it post-date. So most of us would know about from 0 to 40. From 0 to 28 weeks, we usually see our pregnant patients every 4 weeks. When we become 28 weeks, and in our language is hitting your 7th month of pregnancy, at that time we start seeing our patient approximately every 2 to 3 weeks. When you hit the 36 weeks, which means that the pregnant lady has hit her 9th month of pregnancy, we start seeing our patient on a weekly basis until they deliver. So we did our first the first prenatal visit, and now we are going to the follow-up visits every 4 weeks. Between 10 weeks and 13 weeks and 6 days, there is some screening test that we screen for chromosomal abnormality. So it's a test called first trimester screen, or double test, where we do blood test from the mom and we check an ultrasound to check the nuchal translucency for the baby and give a risk about chromosomal abnormality. This is complemented in the second trimester between 15 weeks and 22 weeks, where we check the second trimester screen, which is basically a complementary test for the first trimester screen, and we give a final risk for chromosomal abnormality, meaning trisomy 18, 13, 21, and neural tube defect. This is what we usually do at that point. Around 20 weeks, we do an ultrasound, and it's called morphology ultrasound or anomaly scan. And this is a detailed ultrasound to look at all the details of the baby to see if there is any congenital malformation, not chromosomal abnormalities, congenital malformation. Here I have to dwell on a new test, been there for almost 3 or 4 years now. It's called non-invasive prenatal testing, and this is a test that we do it for high-risk pregnancies where we check for DNA of the baby in the maternal blood and check for these chromosomal abnormalities. And it is a very sensitive test, but it's a little expensive. Going along during the pregnancy, between 24 to 28 weeks, at that point we usually do a blood count just to see if we're anemic or if the platelets are dropping. And we also do something called a glucola test or a sugar test. And this is to screen for gestational diabetes. So we give the mom around 50 grams of glucose and check a blood test around 1 hour after, and to see if there is any increased risk of having gestational diabetes. And if the number is above a certain number, which is usually a 140, usually we push further to see if it's there or not. And we continue during the pregnancy, and between 35 weeks and 37 weeks, so basically when the patient is going into her 9 month, at that point we do something called group B strep culture, which is a culture from the vagina of the pregnant lady. This bacteria lives in 30% of the females, and if it is there, we usually have to give antibiotic when the patient is going through labor so the bacteria does not pass to the baby. And if it's not there, we don't have to do that. This is for a regular pregnancy, of course, and if there is any more complicated high-risk pregnancy, the care usually would differ a little bit. Sometimes around 32, 34 weeks, we do a growth scan to make sure that the baby is growing normally. During the visits, other than the blood test that we do, we usually check the blood pressure every single time comes to us to see if there is increase or decrease in the blood pressure. We do check the weight of the pregnant lady to make sure she's not putting too much weight or little weight. Usually would like them to put around 12-15 kilos during the pregnancy, but that differ based on how much weight or how much they weigh at the beginning of the pregnancy. And usually sometimes we can check a urine dipstick to see if there is any protein in the urine, to see if the patient are developing some complications of the pregnancy. This is the main way usually we follow pregnant ladies during their 9 months of pregnancy. It might change based on different people, but this is the mainstay of it.